Hi, my name is Fatmata Bintabaye. I'm a student of University of Suffolk. My ID number is S317673. Our topic is challenges delivering effective care to adult dementia residents to care settings. Introduction. Dementia is when adults gradually lose memory, have trouble thinking, and cannot easily do everyday tasks. Why is it matters in the UK? It is a big problem for the health and social care that is getting big, which is getting bigger with time due to its progressive nature. We talk about the scope. Almost a million people in the UK in 2025 are experiencing it, with the numbers that is going up. With the numbers going up, with the reference in alzheimer.org.uk.2025. Then, okay, I'm talking about the background, the background of dementia, historic and policy context. Dementia can be tracked in the early 1900s. Alzheimer's was spotted in 1906. Major policy recommendations are 2022, the Prime Minister Dementia Challenge, 2020, the Dementia Challenge, and the G8 Dementia Summit, a 10-year plan for dementia with 375 million set aside for research. Ongoing efforts by NHS for better integration of social care functions. England reference is england.nhs.uk 2025. Then the summary of it is dementia was diagnosed back in the 1900s, though it's only recently that people have been started getting concerned in the UK. There have been plans to deal with it, including the Prime Minister Dementia Summit, Summit of 2012. Currently, the government is planning to, the government has set aside 375 million for brain research. Though these are noticeable, there are issues making the plan to reality. There are other types of dementia includes different types of brain diseases, including Alzheimer's, which are identified as neurodegenerative disorder. In the UK, it has been most common cause of death over the 10 years. Around 982,000 people are affected, and it is expected over 1.6 million will have it by 2050. It is not just about health, it is also about the people who cares about the dementia resident or patient. The National Health Service and the entire care system. The presentation is about how to give good health care to adults with dementia, looking at the challenges what that means, and the challenges, what it means, and it can be actually be done. and what can actually be done for it.
Hi everyone, my name is Andrea. I'm a student at University of Suffolk. My student number ID is S318949. We're talking about challenges delivering effective care to adult dementia residents to care settings. I'm going to talk about background, social, and cultural. There is various factors that can contribute to the development of these diseases, like genetic factors, race, age, and family history. There is a variation across studies. Research in the UK suggests Black adults have higher incidence of dementia compared to white people and South Asian adults. Common social factors include reliance on unpaid caregivers and again population and regional difference. Culturally, despite there is rising awareness. Care inequalities and stigma are relevant. Care issues, recruitment, retention, and training. Lack of experience and high trained staff cause an ineffective delivery of high quality dementia care. Inadequate understanding of dementia and person-centered care among some staff lead to inconsistent care and negative outcomes. High turnover. The high turnover rate in dementia care in the UK is a significant concern, with around 30% of employees leaving their roles annually. This turnover not only impacts operational continuity but also creates critical gaps in skills and knowledge, directly affecting patients' safety and the quality of care provided. Having well-trained and support people who care for dementia patients is highly important. Maximum care givers do not have special dementia training, and places including general hospital floor are not enough to help people living with dementia feel supported and comfortable. Critical, only a small part of the funds invest on health care of dementia goes towards its early recognition, even though that can really help people and save in the long run. Key issues: increasing complexity and severity of dementia case. More residents are admitted with advanced stage and higher care needed. Require more specialty and intensive support. Cognitive decline combined with physical frailty and mix of diseases symptoms increase care complexity. The complexity and severity of dementia cases are increasing, with new evidence suggesting that as many as 1.7 million people in England and Wales could be living with dementia by 2014, a 42% increase from previous estimates.
Hello, my name is Temidayo Akisainwa. I'm a student of Suffolk University. I'm studying health and social care. My student ID is S317490. I'm here to present our group assignment with the topic Challenges Delivering Effective Care to Adult Dementia Residents to Care Setting. The key issues are environmental and psychosocial factors. That is, difficulty adapting to residential environments, which causes distress. Another point is care homes often lack sufficient dementia-friendly adaptations and stimulating activities. Social isolation, stigma, including related to race, ethnicity, gender, identity, and sexuality. And loneliness affects many residents. Family members who take care of loved ones often face huge emotional, monetary, and social problems. In England, about 5,000 and 40,000 caregivers juggle caregiving with their jobs, even at the cost of their work or quitting entirely. Loneliness and mental stress are very common among caregivers due to feeling cold and impersonal while caring for dementia patients. Care homes and daily schedules often do not consider what residents want or experience, which causes dignity and distress problems. Statistical data. The charts indicate a comparison of the economic impact by dementia at present and possible future projections. Estimated cost of dementia in the UK in 2024 to 2040. In 2024, £42.5 billion. It is estimated that in 2025 it will be £44.5 billion. In 2030, it is estimated to be £57 billion. In 2035, it's going to be 71.4 billion, and in 2040 it is estimated to become 90.3 billion pounds. This source is from dementiastatistics.org 2025. Key numbers show around 9,820,000 people are living with dementia right now. That is in the year 2024. That can be over 1.6 million by 2050. There is another slide that shows how much economic burden dementia can create, as it can be more than double in just 60 years, causing much pressure on healthcare, social care, and those who care for people without being paid. Additionally, in 2024, about 982,000 people in the UK were living with dementia. That is expected to go over 1.6 million by 2050. These statistics indicate urgency to take improvement actions for better and fast dementia care delivery. Practical implication, workforce issues, and healthcare strain. Healthcare is struggling due to delayed diagnosis and frequent hospital admissions. Healthcare workforce is also feeling pressurized, causing frequent burnouts, training gaps, and overworked staff. Lack of adequate help from community support and places that are poorly designed. As communities do not have enough support with unclear information on how to get a diagnosis, dementia often goes unnoticed for too long. This means people with dementia symptoms end up in the hospital in crisis situations that could have been avoided. Additionally, if staff are not well trained, the provided care will be of low quality. A large variation of this quality can be seen based on geographical differences due to training inequalities.
Hello everyone, my name is Ariana and I'm a student at Suffolk University. My student ID number is 6317610. Today I'm gonna talk about challenges delivering effective care to adult dementia residents to care settings. So I'm gonna pick it up where my previous partner left it. So she was talking about practical implications. She did mention a couple of them, and I do want to mention a couple more of them, which are inequality and unpaid burden. So what I want to talk about this is that family members are often unpaid caregivers dealing with unpaid jobs, losses, financial stress, and mental health pressure. Informal caregivers face huge challenges while giving the time in caregiving while quitting the jobs, which directly affects them on them on their mental health. The healthcare access is unequal, as accessing to different services in rural or deprived areas become challenging. People in poorer or rural areas often have people poorer or rural areas often depends on emergency services, which worsens the systematic inequalities. For instance, I do want to mention with closure of community service and expensive care homes, health crisis is becoming acute for families and can end up in a serious financial crisis. Okay, now we're gonna talk about some recommendations that could tackle some of the experience issues. So I would like to say that it's very important investing to diagnose Alzheimer's in an early stage, because that could keep out of the hospital and out of crisis um, a lot of patients dealing with dementia if they tackle it on an early stage, and um, that would reduce a lot the cost. Implement efficient training facilities needed for the workforce is needed who cares for people with Alzheimer's. Healthcare and social care workers need to be trained on how to deal properly with this type of disease, because what this is gonna make is gonna improve the service, is gonna improve the quality on the service. Continuous local services are needed to protect places and support groups which can be accessed by common people. These shall be continued as they can be ease activities of caregivers from family. So which means that which means that which means that if these centers they remain open, the family members can seek help with them. They can seek help in these places, so that would really ease financially. That would ease all, let's call it, burden that the family could feel by having to do everything by taking care of people with dementia with no proper training. Help unpaid carers for Alzheimer's patients by giving them breaks, mental health support, and financial support as well is needed. Fix and fairness. Fix and fairness by focusing on helping people that live in rural and poor areas, so they can have access to the same care as everyone else. Specific plans are needed to fill the gaps between different areas and social groups. Yeah. So now this is the summary in conclusion on caring for dementia is a challenge due to high demand, economic burden, working insufficiencies, and inequalities. Urgent reforms are mandatory through detecting dementia early, training, getting dementia early, training training more workers, are reducing inequalities to provide fair treatment. Additional issues include a lack of all right. Additional issues include a lack of enough training, closure of community services, and caring pressure. In conclusion, dementia case in the UK is facing critical issues as people experiencing it is increasing at early ages, with services becoming very expensive. There is a lack of enough workers, and family carers are becoming stressed, added with an acute geographic and social inequality. Fast actions are needed to be undertaken to deal with this growing demand, indicating a prompt need of recognizing dementia, providing training, keeping community services going, backing up family carers, and reducing inequalities in accessing care. Well, this is the end of the summary, and thank you very much for your attention.